think this is such an important question. So here's the scenario. You work with another therapist who has lots of years of experience and kind of goes by treatments that the patient can tolerate. For example, you saw in a book, the protocol says a closed fracture of a wrist bone looks like this, and you can start strengthening at 12 weeks to overstressing the wrist. However, she started putting him on weights at 11 weeks versus waiting for the full 12. And even though he feels more sore and stuff like that, wanted more advancement, was happier with this more advanced therapist because she advanced him earlier. It also appears to be the normal that she goes by patient's tolerance rather than protocol. As long as it's about 6 weeks out, she goes by pain tolerance strengthening, which confuses you, right? So I get that. It appears to be working. Sometimes it does. So she upgrades much faster than me, and it's really not an issue, but I just don't know how to clinically reason when we are treating differently. What are my thoughts on this? Because I am not confident about the outcomes of the conditions I'm seeing over time due to the fact that I've only been working about 3 months, and it's really hard for me to gauge. Does that come with time and experience? So yes, it does come with time and experience, and over time you will start to see and feel that your experience of gauging when to get started gets better and better and better. You cannot make it go any faster in terms of your experience and your feel for things, right? And what do I think about you working, appears to be working differently? So I'm going to go into a little bit about that when it comes to strengthening. Patients appear to prefer her faster advancement of exercises than my slower pace, right? And I asked her, should I advance my exercises faster? And she says, I'm doing fine. But many of the patients seem not to like the pain-free type of exercises that I give because it's not challenging enough. How should I shape my thoughts around this? Of course, you're going through a roller coaster of emotions and stuff. So I experience that all the time because I'm the more advanced therapist, and I bring in people who have lesser experience, and then I can quickly think through stuff because I have that experience, right? So we might be all therapists and we might be all hand therapists, but at the end of the day, when someone has more years experience, you cannot catch up to her. You can only catch up to yourself in terms of what you're able to do and what you're not able to do. So really what happens in confidence, right? So let me see if I can explain confidence well. Oh no. So here's our confidence. Your confidence can either go down or it can go up, right? So here's when it goes down and here's where it goes up. So how do you actually really get confident? Well, you actually only get confident when you're successful, right? So when you're successful, you go up. And so you're relying on your patients to say, yes, I feel good. And so you feel successful, you go up, right? And as soon as something happens and you don't feel as successful because they say to you, I don't feel as good, or I want more, but you're not giving it to me, for example, your confidence is going to go down. And that's because somehow you feel you're not successful. That's why, when you're a new person in the field or you're trying to do something new, right? When you're trying to do something new, your confidence is going to go up and down, up and down. That's why you're on this roller coaster ride. So that is completely 100% normal, and you are like everyone else who's doing this, right? Anyone who's moving into hand therapy, anyone who's been doing it for a while and now wants to sit for the CHT, they don't feel as confident because they've never taken the test before, or they don't feel as confident because they've taken the test before and have not felt successful by it, right? i.e. passing. So then they're not going to feel comfortable, and they're going to have some type of baggage or some kind of thinking about that, right? And then take me and other people, other OTs who are moving into the business realm. I've never had a business before in my life until I started the business, my clinic, and my emotions ran up and down because my confidence was shaken. Every time I got a patient, I was like, yes. And then every time they left me, I was like, no, but you do this long enough and you will level out, and you're never gonna not go on this roller coaster ride, I promise. Because always in somewhere in your life, you're gonna hopefully try and do something new, right? So the key thing is how long do you wanna stay down? How long do you wanna stay there, right? How long do you wanna stay there? Well, I sure as hell don't wanna stay there very long. I wanna do things that then are gonna help me feel successful, be successful. And the way you do that is being in a group like this where you can ask those questions and you can have that critical thinking. And when I talk about it, it's critical thinking, problem solving, and decision maker. You are critically thinking through things correctly, you are problem solving through them correctly, and you're making a decision. And it's not that it's wrong, it's just that, just like Goldilocks, right? Goldilocks and the Three Bears, she goes and she tests every mat. And one bed is too soft, and one bed is too hard, and then she tries this one bed and it just feels just right, right? That's where you are. You're critically thinking through things well. You're problem solving through and say, okay, this is a broken bone. This is the protocol that I should adhere. And where you're lacking is that experience that 15-year experienced person has of saying, I feel like this is what I do. I'm like, I feel that's really good, and then I can make decisions faster because I've had that experience to tell me that those things work and those things don't work. You are now building your experience, building that feel in there. And so I hope that allows you to feel more successful with your thinking, and then take it to the next patient, which will then help you when they do well to feel successful. But really, at the end of the day, you should feel successful regardless of their outcome. You should feel successful that in your communication with them, that they buy into what you're saying. Yes, that's wonderful. And I don't discount, listen, that's wonderful that person was doing what they did with you, because I wanted to do that too, but I also am a little bit more conservative. This is why we work so well together, because there's going to be days where you're going to be with her and she's going to work you really hard, and then there's going to be days be with me, and we're going to do different things that are still going to help you really at the end of the day achieve your outcome. And then because she can do those things a little bit faster than you, you're watching her and you're saying, okay, that works and that doesn't work. She went too fast, and now I'm getting this guy coming in a little bit more painful. She did that more like a week faster, and she's getting better results. I'm gonna copy that next time, because a 1 week before is not too bad based on their level. When you have someone who you're trying to decide, you can try things and say, I'm gonna try and see if you can tolerate this. And we can progress just a little bit faster based on if you can tell me that after you do this, you're not too painful and too sore, right? There's a balance. There's always a balance of doing too much and not doing enough. And we want to be right in the middle. And you want to listen to your patients, to those people who are talking to you, because they know their body as well. So I'm not going to rush you. You shouldn't rush this process. But I'm going to listen to you. If you feel it's, okay, like you don't have any pain, you've got great motion, let's try a little bit, increase it just a little bit. So you don't have to be so strict with your protocol. Protocols are guidelines that guide your thinking, or guide you if you're not really sure about your thinking, but you can test. Like, I have that flexor tendon and I test them every single time, and I would have taken that splint off at 5 weeks. I would have taken it off versus a 6-week protocol, because my experience tells me you're stuck. That shit's not going anywhere, even if you wanted to do something, right? It's not going anywhere. But because you are scared and fearful, I'm gonna let you keep it on for just another week while I talk to you every single time to wean off of that. Now, if someone wants to be more aggressive, you can have that conversation. Okay, let's do a little bit, and then we'll do a little bit more next time and a little bit more next time. If you are so far off your mark and you're way too easy, you can work in a pain-free range, but making it a little bit more difficult. right? Difficulty is just based on how they feel about that, right? Weights or no weights or whatever, just a little bit more difficult. And that does take experience. And the most important thing, right, is that you can change that conversation however you want. You change that conversation however you want. Oh my God, I'm so glad that she did that with you, and now you're good to go. Let's do it, right? So you're like hopping on that bandwagon. You're like, okay, I'm with you. I'm there. I'm down. Let's go. And that has nothing to do with you, right? And so that patient can still love and support you and want to come back to you, because you're gonna jump on that bandwagon, because they're gonna progress so much faster with you, supporting that, right? If they work with you and they work with someone else and they were too aggressive and they come back to you so sore, oh, it's okay, let me work with you and let me ease that pain, and today we'll take it a little bit easier, and then next time we'll try it again, because that's okay if you're a little sore. So either way, you're in a winning position. Right? Either way, you're in a winning position. I hope that kind of conversation helps. But really, at the end of the day, how long do you stay down before you get back up? And that's the most important thing, to not stay down too long. Courage, essentially, to do it again. Courage, again, to get back up and say, okay, how am I going to do this differently regardless of this apparent down outcome, right? And practice allows you to get better and better with time. That critical thinking, that decision making, that hands-on skills, that's going to help you each and every single time get better and better. We don't become experts in a span of a month, 2 months, 9 months. It's a process for us. I mean, I still learn all the time. I'm 20 years in, and I find that the things I've learned, like, I've forgotten. I'm like, oh yeah, let me go back to that, and let me do this a little differently, or let me change it this way based. So we're always on this path to learn, and I hope that you continue on that path to learn, because that's the most exciting part. And the people who shit on therapy and OT and whatever, they've somehow lost that mojo to keep learning, and I hope that they found something else to learn, because that's kind of like what we do as human beings, to find that like fulfillment. It's like we're always trying to learn about something else, so courage to get up and do it again. Practice, courage leads into practice, because if you have courage, you keep practicing. And then of course it's that mindset to like say it's okay, or be in a group like this, or in the Facebook, and putting out your stories or questions in that group, because they're all on the same path that you're on, and saying, how do I change this mindset or this negativity? And I was never a huge mindset person before, and I didn't realize how important it was until I really started to go into business, and to realize, like, man, I was, if you work in a group of people and all they talk about is negative, and I never really thought about that, because I used to work in a really big hospital, and it was funny, because in the nursing home, everyone there was positive, like I didn't really realize it, but in that nursing home, some of the OTs and PCs, oh, I love it. I'm like, how many years have you been doing this? They're like 5. I was like, oh my God, that's so long. Like, I knew shit from shit. And I was like, and I never knew that they were, happy and content, and they love doing what they do. And then I go into this hospital setting, and I thought, wow, everyone should love working in a hospital. And they were all like, oh, everything sucks, and therapy sucks, and like this department sucks, and then you don't even realize it. And I didn't realize that was mindset, but I really needed to remove myself from that kind of group, and then try to find another group where I could like fit in and be more of a mindset. So if you kind of not sure, sometimes it might be like a mindset thing, like why do I not feel good with these people? And sometimes because they're so freaking negative. How do I turn around this negative thing into a positive thing, and how fast can I move myself out of negative mindset into a more positive mindset? Who can help me with that, right? So it is completely normal to go up and down, and I hope that does not stop you, and I hope that actually drives you, to do more and more and your lack of experience will only build over time because you have the courage to keep going and to not give up. To answer your question, is that good?
Yes, thank you.
All right, sounds good.